we do recommend also people, taking breaks and not just taking high doses of Fedosia agrestis year round, because with exposure to any compound, it's going to be the dose and the duration that either make the medicine or the poison. So, just being reasonable, being more on the conservative side, taking maybe 3 weeks on, 1 week off, or 1 week on, 1 week off. So the human mouse equivalent there is something like 250 milligrams is kind of your upper safe limit of daily intake. But then people are like, well, I want to take more. So I don't recommend that people take more, but if they do, then we talk about, risk mitigation. And there's a couple theories about this relating to reactive oxygen species, oxidative damage, and some potential ways to mitigate those. So perhaps we talk a bit about that.
Definitely. So when you're thinking about the toxicity of a not very well studied compound, however, a compound with a very long history of human use. In traditional medicine, you're trying to find the mechanism of action of toxicity. And there's actually papers on Fedosia agrestis. By the way, there is other species in the Fedosia genus that's very interesting for hormone and testosterone optimization. Agrestis is just getting a lot of attention right now, perhaps because of our friend Dr. Andrew Huberman, and also Derek with More Plates, More Dates, and even Joe Rogan. But specifically with Fedosia agrestis, there are studies that say it is an antioxidant and it helps improve spermatogenesis in the testes. And I believe that's also a rat study. I believe that's from August. We'll link these, of course. And there's also studies, there's kind of like a group of studies that looked at different doses of Fedosia agrestis. And they looked at increasing markers of oxidative stress, like alkaline phosphatase and gamma-glutamyl transferase, GGT and ALK-Phos. And those can increase. However, when you look at labs, and often we do check these for individuals that are on Fedosia agrestis, it's actually pretty seldom that you see those increase. However, there can be a decrease in the testicular size. It's not, it's correlated with the changes in ALK-Phos or GGT. However, we don't know if that's causatory. It could also be that the efficiency of the testes, both for testosterone production and spermatogenesis, improves. So the size could potentially decrease.
Yeah, some interesting theories, and like I said, we're excited to see more research in this specific area. So the way that they have shown testicular toxicity from various compounds to be mitigated in animal models, usually with antioxidants, and sometimes very high doses of antioxidants, like what would be the equivalent of, I don't know, something like 500 grams of taurine in a human. Yep. But N-acetylcysteine seems to have a fairly potent effect at a lower dose. One thing I do want to be cautious of is not necessarily overstating the benefits of antioxidants and extrapolating those from animals to humans, because if you give a mouse vitamin C, for example, at high doses, it's going to ameliorate cardiovascular disease, which we know is not the case for humans. The way they develop cardiovascular disease is a little bit different than ours, and it's usually cancer that's going to be the leading cause of rodent death in a lab versus cardiovascular disease in humans. But there have been studies with taurine that mitigate testicular toxicity. Doses are pretty high there. There have been studies with N-acetylcysteine that also mitigate testicular toxicity. Usually these are with heavy metal exposure or with things like anabolic steroids that they're giving to these mice and looking at testicular effects, probably for some of the early research to try to develop a male contraceptive, something like that. But the N-acetylcysteine seems to be something that could potentially push back a little bit against any extra oxidative stress you're having there. It's a direct precursor for glutathione. We know those levels decrease with age, and people's capacity for dealing with that oxidative damage decreases with age. And there was a study earlier this year, I think they used glycine and N-acetylcysteine, and this was in older adults, and they saw the improvements, reductions, just like you would expect in that oxidative stress and damage. So we have some pretty solid data to base that on. We do recommend also people taking breaks and not just taking high doses of Fedosia agrestis year round, because with exposure to any compound, it's going to be the dose and the duration that either make the medicine or the poison. So, just being reasonable, being more on the conservative side, taking maybe 3 weeks on, 1 week off, or 1 week on, 1 week off. There's different ways to do it, and then perhaps supplementing that with a little bit of antioxidant support, typically in N-acetylcysteine or in ethyl ester N-acetylcysteine, which is a newer compound that we've seen some companies having on the market.
Yeah, that's a good summary. I'd say the top three, along with NAC, would be taurine, which we mentioned, or ursodiol. And they have a taurine-ursodiol combo known as TUDCA as well. So that's also used for other like inflammatory conditions. So those would be some things to consider. A general dosing would be 300 milligrams or less per day with a 3-to-1 ratio or more conservative. So like 3 weeks on, 1 week off, perhaps 3 months on, 1 month off for some individuals, especially if they're getting labs, and of course doing this in concert with your healthcare provider.
Absolutely.